How's the bedside manner of the patient in chief? I'm Scott Ott, and this is Bill Whittle now. And Bill, I know that's a kind of weird way of phrasing things, but during the last several days, as President Trump has recuperated, first at the White House and then at Walter Reed Medical Center, and then at the White House again, from his infection with the COVID-19 novel coronavirus, there's been much made of the fact that it seems like the doctors may be under the direction of the patient. It's a syndrome that's not entirely unknown and not peculiar to President Trump. It's called VIP syndrome sometimes, where basically the patient is so powerful that he can actually direct and dictate the course of his care. And I just want to kind of go over several things and get your thoughts on how things are going so far with the president. And let me start with, I think, what is the most kind of problematic thing when you're treating the president of the United States and you're a military doctor and he's the commander in chief. How do you deal with that kind of situation? And essentially, most doctors are used to giving orders to their patients.
I guess you give him everything he wants up until the point where your medical expertise tells you that this is dangerous, at which point you insist. And I get the feeling that Donald Trump is used to getting everything he wants. And I also get the feeling that if a medical doctor said to him, "Sir, if you do this, your chances of dying improve significantly," he wouldn't do it.
So there's no indication from what you've seen so far that that the doctors may be being led by their patient rather than the other way around. It's
been my experience in life that doctors take their jobs pretty seriously, which is good for all of us. I don't think that I cannot imagine a doctor, really almost any doctor, but especially a military doctor, who would allow himself to be bullied into something that he knew would be damaging to his patient. I can certainly see cases where a demanding patient or a powerful patient might, let's just take an example, might basically demand to be released early to go back. Now, that's not the kind of thing where a doctor can say, "Sir, if you do that, you're going to die." It's the kind of thing where maybe he thought, well, I would have rather had him here for another day or two. He wants to go, but if he gets worse, we'll bring him back. So all I'm trying to say here is on the spectrum of doctors standing up to their patients, powerful patients, VIP patients, unless you're the kind of guy that's writing prescriptions for Michael Jackson, and that's not a real doctor, it's just a guy with a medical degree, then there comes a point for every doctor where they'll put their foot down. And the fact that it doesn't seem like any of them did is an indication to me of how well Donald Trump has weathered this COVID-19 infection.
Now, as we record this, the president has returned to the White House. He was eager to do so in announcing as early as Saturday that he felt like he could walk right out of there. It's a little different than the average release from the hospital. This is not like when my grandfather told the people at the rehab center that if they didn't let him go, he was going to crawl out of there despite the knee surgery. Because when the president goes to the White House, he's got the entire medical staff with him.
Right.
That said, it seems like they kind of threw the kitchen sink at him as far as treatment goes. On the one hand, by giving him steroids and remdesivir and various other kinds of monoclonal antibodies and things I don't understand at all, while telling the public that basically he was doing pretty well. What's been your perception of how forthcoming the doctors have been and how forthcoming they should be? And I can give examples if you'd like.
Sure. Yeah, why don't you give me one example?
Yeah, let me give you an example. In the first news conference from Walter Reed Medical Center, Dr. Sean Connolly, who's the president's personal physician.
President Trump's personal physician is Sean Connery?
One ping only, Vasily.
One single pill only.
So they were pressing him on the question of whether the president had needed oxygen support at any point. Did he need help breathing? Mm-hmm. And it was clear right away that the doctor was dodging the question. He immediately said he's not on supported breathing right now. And then they said, well, was he on supported breathing Thursday? And he said, no, he was not on it Thursday. And then somebody said, was he on it Friday? And then he answered that by basically saying, when me and the team of doctors were with the president on Friday, he was not on supported breathing. So it was almost comical the way he was dodging it. Later on, he acknowledged that, in fact, the president had been on supported breathing. When they asked him why he dodged the question, he basically said, because I wanted to make it sound good. And I'm really paraphrasing there, but it's a combination of we don't want the public to be concerned and we don't want to say anything the president doesn't want us to say. Should the president's doctor have to be more direct with the American public who are not only about to go to the polls, but are going to the polls right now about the president's health?
Not if he's a Democratic president, they don't.
How so?
Well, with a Democratic president, whatever the doctors reported, the news media would figure out the best way to present this to maximize the glory of the president, and then they would print that. But with a Republican president, it's different, and with Donald Trump, it's different squared. So what this doctor is dealing with is he is trying to navigate, and he deserves credit for it because it's not an easy thing to do. He's trying to navigate the best way to answer this question truthfully without causing the stampede that would have occurred if he said the president is on assisted breathing or was on or whatever. He's fully aware of the fact that the press is functioning as a hostile body here, and his job as the doctor now is not only protect him from viruses, but to protect him from these human viruses that are going to take anything he says. I'm not saying they're going to take it out of context, although that wouldn't surprise me. But they will take anything that he says and turn it up to 30 and do nothing but trumpet that, if you'll pardon the expression. They will do nothing but president on assisted breathing, moments left till, all of it. And they're going to, since this beginning of this COVID crisis, the media has been responsible for inflaming people's fears, and it's been especially responsible for causing hysteria, intentionally causing hysteria. And I think that this doctor was doing his best to navigate that minefield, and it sounds like he did a pretty good job.
Well, and this isn't a case where the media was doing some private interview with an unnamed source that was going to leak some information. Everybody was watching this news conference. I mean, anybody who had any interest in what's going on. And so it seems like that's a little bit of a different situation. And later, Mark Meadows, in remarks that he thought were not going to be reported, basically acknowledged to White House press that the president's condition was more serious than anybody was letting on. There have been many doctors who've commented that the fact that they put the president on a steroid indicated that he did not have a mild or moderate version of the disease, and it was more serious than they were letting on. Let's buy every argument you just made about the media. The president has the most powerful bullhorn, fire hose communication channel with the American public through his Twitter feed, and could have broadcast exactly what the situation was so that there could be no question and he could speak directly to the American people. Why not do that and do it in a very forthcoming manner?
Because it's not a manly thing to do.
He's not a manly guy. He's the president of the United States.
No, he is a manly guy.
I mean, sure he is, but he's not.
No,
that's not.
It's not.
His role is not just to
not,
be a suck-it-up man. His role is to be president of the United States.
If I'm going to have a president of the United States, I'd like it to be a suck-it-up man or a suck-it-up woman. But whoever it is, I'd like them to be courageous, and I'd like them to be optimistic, and all the rest of it. If every single time, every single person that had to do something difficult was asked, "How do you feel about this?" and they told the exact truth, we'd still be in the caves.
But Bill, this is a little different. All summer long, you've been hard on the Biden campaign and the entire Democratic Party for putting forth a guy that you believed had serious problems. Back in 2016, you were critical of Hillary Clinton's campaign and said they were hiding her medical conditions. Here, it appears that they are downplaying at the very least, and in some cases, possibly hiding the true nature and extent of the president's condition. And yet you're okay with it here. Why wasn't Hillary Clinton a manly man back then?
Hillary Clinton and Joe Biden have chronic problems that get worse over time. If Hillary Clinton's dizziness or if her inability to walk up a flight of stairs was limited to a 3-day period, I wouldn't think anything of it. And if they didn't report it, I wouldn't think...
Donald Trump has something that could kill him.
He had something that could kill him. He appears to have recovered from it.
Well, even his own doctors aren't saying that. They say it's really that sort of 7 to 10 day window where they're really looking for the worst possible result there. They don't say, his doctor said, even though we're sending him back to the White House, he's going with the full medical staff and he is not out of the woods.
Okay, so let me answer this with two things. First of all, somebody texted me and said, how worried are you about Trump? And I said, well, considering that the Center for Disease Control has published that people in his age group have a 99.94% chance of recovering once they've been tested positive, I'm 0.06% worried.
They also have a 90% greater chance of dying than people in the 18 to 25 or 30 age group.
But now you're splitting hairs down to individual atoms, because the number of people who die in the 18 to 30 age group is so close to zero that zero is the nearest whole number. So,
but let me state it another way. Most of the people who've died of COVID-19 have been in Donald Trump's age group and with comorbidities like obesity and other things.
Well, all I have
and again,
to say
it all
about
gets back to, shouldn't he have been more forthcoming is the thrust of the question.
No, I don't think he, look, if he, first of all, there's the whole media environment that I mentioned just a minute ago. And secondly, there's the transient nature of this. This is not a cancer diagnosis or anything like that. This is something that we're going to know, that we would have known, in fact did know, in the space of 3 or 4 days. We would know right at that peak period of risk. We would know whether or not the president was in real trouble or not. And I have no doubt that if the president were in serious real trouble in terms of his health, then he would have handed the reins of the country over to the vice president. But it doesn't appear that he ever got into that situation. Now, you can argue, and in your role of a mild-mannered liberal reporter that we pay you to play, you can argue that this was irresponsible on the part of the president. But to me, it's not only not irresponsible, I hate overusing this word, and I'm going to use it with a great deal of censorship like I just did. But there's something heroic about it. I don't mean big heroic. I mean just average quality, daily quality of life about it. People go to work sick all the time. People work heavy construction cranes and they're doing dangerous jobs and enormous pieces of moving steel, and they do it with the flu, and they do it with worse than the flu. And they go to work and they do it all the time, and they don't talk about it. They don't cry about it. And when somebody asks them, how you feeling? You look a little under the weather. They say, I'm fine. Then they take an aspirin, they go back and finish the job. And that appears to me to be what the president has done. I've had so many times on this show where I've had a sentence or a statement or something, and I always say, I read it somewhere and I couldn't place it, but this time I saw something I liked so much that I wrote it down, and I wrote down the person who said it. And it's one of the few reporters left in the world, Heather McDonald, said that what Trump had done was he had broken the cardinal rule of modern progressive thinking. She said he had committed a violation of the avoidance of maximal risk. Violation of maximal risk avoidance. So what she's basically saying there is, in a society where everything is about risk to you, where 20-year-old person has a 99.9993% survival rate if they test positive, and only a small percentage of the population test positive. When you're dealing with a world that is that resistant to facts and that prone to fear, you end up with a society that is geared towards maximal risk avoidance. How can we do what? In other words, you end up with a society, and we're heading that way, and people like us are fighting against it, where the elimination of risk to your personal body becomes the single greatest factor in determining your behavior and everyone else's behavior. It's the kind of thing that allows people to say, well, if the governor will let us go back to the beach when he says it's safe, because God knows, he knows better than I do about my health. It's this avoidance it's maximal avoidance of risk.
So Bill, let me push back on that premise a little bit, because there are two factors here that I'm not sure you're taking fully into account. Number one, it's not just him risking his personal life. This is not some 45-year-old guy who decides he's going to do some untethered rock climbing on a 4,000-foot rock face. This is the president of the United States. The other thing is, at latest count, some 12 White House staffers and possibly more have contracted the coronavirus as well. And while the president was at Walter Reed Medical Center, he decided that he would take a little parade in his motorcade and go out and drive around and wave to people. Now, he's inside a closed vehicle, so the people he was waving to were at no risk, but the Secret Service people and anybody else in the vehicle with him, even though they were wearing masks, are still at some risk and at very least will have to be isolated for some period of 10 to 14 days. So it's not just what the president's doing with his own well-being. He represents the country. Worst case scenario, imagine the president and the vice president coming down with an incapacitating illness or possibly worse than that. Doesn't he have to be a lot more careful than you and I do?
No. And let me deal with the Secret Service thing first. The survival rate, this is not my guess, this is the data from the Center for Disease Control, and this is not factoring in comorbidities. But the survival rate for people in their 30s to 40s, which is about the age of Secret Service men who are in peak physical condition, is 99.9993%, something along those lines. Which means that if the Secret Service gets into a enclosed vehicle with Donald Trump, and Donald Trump has the coronavirus, that is probably the safest few moments out of that agent's day. That's probably as safe as they're going to be. When they're outside, getting in front of bullets and worrying about that kind of thing, their risk goes up significantly. And this is the point of the whole thing. This is the point of the whole thing. It is an indication of the overreaction and the hysteria that we've endured for the past 7 or 8 months now. And the fact that Donald Trump has decided to basically bull his way through this is not an indication that everybody could have bulled their way through this, but it's an indication, certainly, that he's a tough, strong, willful guy, and he is doing what I consider to be not only the right thing as a president, but the right thing as a person. He's basically manning up and he's going back to work. Now, if this was a permanent situation, if he banged his head and he had permanent brain damage or something like that, that'd be an entirely different situation. But to say that the president is somehow obligated to broadcast the worst possible case scenario of his health while he's under medical treatment so that the American people can get more hysterical about things, I don't buy it at all. None. Franklin Delano Roosevelt was in a wheelchair for his entire term, which I think he was in office for 75 or 76 years or whatever it was. But it was not commonly known to the American people that he was in a wheelchair that entire time because it wasn't the people's business. The business was, can FDR do the job of the presidency? And it turned out he could. So that's where I come down on this thing. If Donald Trump maintains a fever and has serious coughs and has to be put on a respirator every night for the next 3 weeks, we got a whole different story now. But the reason that this is such a story, and the reason that I said on the last time we talked about this, is that whether we like it or not, whether it's fair or not, whether it's appropriate or not or whatever, this is going to be the American COVID-19 case. This is going to be the one that everybody is going to know of. Many people have suffered the loss of friends and family with COVID-19, and many other people, a great larger number of other people, have had friends and family or who have themselves contracted the disease and made a full recovery. So the reason that the press is harping and screaming about, well, we didn't know that he was on a respirator. What was it? Yeah, maybe it was more serious at the time than he let you on to know. But it wasn't so serious that he was incapacitated, and he wasn't so serious for such a length of time that it affected his duties. Donald Trump, with COVID-19, is far more energetic and making far more public appearances, dealing with more people and getting more things done than Joe Biden does by 10 o'clock in the morning, every single day. And that's what they can't stand about him. And that's what I like about him. And that's what his supporters like about him. They like the fact that he got into the vehicle and went down and waved at them. They like the fact not just because he wanted them to know that he cared about them, but they like the fact because what he did there was not for the supporters on the street. Well, not just for them anyway. What he's doing is getting out there and waving and saying, I'm all right, I'm fine. I've got a little medical problem. It's okay. We got the best doctors in the world and I'm going to be fine. That's called leadership. That's called inspiring confidence. And in a world where we didn't have this burning hatred towards this man on the part of the media elites who he embarrasses on a daily basis, then that's what this would be looked at. This would be like Franklin Roosevelt standing at a podium and giving a speech. Despite the fact that he can't stand, you could take that as him lying to the American people, or you could take it as a sign that he is determined to show the American people that this is something that we should be careful of, that we should deal with. But it's not the end of the world, and it is not the end of me. And I think he's handled it spectacularly. And I think that's unforgivable, given the political climate, especially given the climate of the fact that here in California, businesses are closing down on a daily basis because the governor has decided that it's not safe to open. There's more hospital beds than we know what to do with. We did a segment not long ago on how New York, Bill de Blasio says, we're going to keep New York locked down until there are 0 new cases of a flu-like virus. So this is the inoculation against that kind of thinking.
The members of BillWhittle.com have provided the funding and, frankly, the inspiration for us to produce some 40 programs each month, 40 new episodes of brand new content, thanks to them. If you've not yet become a member at BillWhittle.com, in addition to helping us spread the message of liberty around the world, you'll also get to know some people, some of whom will become longtime friends of yours. You can even not only read the member-written blog, but you can actually write the member-written blog. And so if you haven't experimented with that yet, give it a try. It's just $10 a month. If you don't like it, we'll cheerfully and rapidly refund your money, but we make that offer because we rarely have to do it, because people actually like it. Go to BillWhittle.com and click that big green Become a Member button. For Bill Whittle, I'm Scott Ott. Thanks for watching.